Jim, would you mind stating your age for the record, please?
69 years old.
Looking good. Looking good. And Jim's been with us for his for the Diamond program. He's been in our top program for about 11 months now. We've done bone marrow aspirate, we've done PRP injections on his knee, and we've done our sort of comprehensive wellness program. Jim's been having some great progress with his weight loss. He's been feeling really good. So Jim, just tell us briefly, what was life like before your treatment? What were you unable to do that kind of made you upset?
Well, before the treatment, I was restricted in what I could do physically.
Mhm.
I've been a mechanic all my life, and so I encounter lots of things where I'm lifting heavy weights, moving, twisting, and whatnot. And the knee pain was really taking a toll on my activities there.
Right. We talked briefly about a knee replacement, and that just wasn't something that you wanted. That wasn't a road you wanted to go down at that point.
Well, it was certainly one I was considering,
Right.
but I didn't know that there was other things that could be done that would give me a relief in what I was experiencing.
So what finally triggered you to come in and meet our medical staff?
Well, it was getting bad. I've already had my right knee replaced, and I was seeming like I was going down the same path that my right knee had sent me on. So I was definitely considering the left knee replacement.
Uh-huh. And what type of concerns did you have prior to our, starting the program, the procedure?
Well, it's all new to me, and I didn't really have any history on it or any knowledge of it and the benefits that I could get from the procedures. So it was a learning experience for me.
Yeah, learning experience for most of the folks that we bring in here. It's even though this technology has been around for 25 plus years, I think it's only just now really starting to gain acceptance. There's really starting to be a lot more research that supports it, and a lot of patients like yourself who get great results from it. So, what was the procedure like for you? What was the experience like?
Well, it was all new, all new experience. I've had shots in my knees in the past, and I've had Synvis shots in my left knee, and it would provide temporary relief. It was difficult to make it between 6 month intervals
Right.
without
So it didn't
having.
last long enough. The other stuff wasn't lasting long enough.
No, it was temporary, strictly temporary. And what I've got going now with the treatments I've had now, it's lasting. And the only time I really come into realization that I have a problem is if I like step in a hole or twist my knee or
Yeah. So you have a trauma to it.
pick something up heavy, that brings it back to me pretty quick.
Yeah. And we're still working on that. We're still working on the weight loss. We're still working on the overall health and wellness.
Right.
And that's continuing to improve from what you're.
There's no question about it. Each pound that I lose is significant in the additional things that I can do physically.
And I think that's a critical part of what we do is that the weight loss, the combination approach of the biologics plus the metabolic wellness, I think that's the special sauce.
Yeah, all of it added together is really great. I think anybody wanting to pursue this avenue of treatment, if they'll just take it all together, I think they'd be happy with it, as I am.
And I think that's a great point, right? Like if we just do one piece of the puzzle, it's not going to be as effective as if we do more.
Right, I would agree.
That's our approach. So what kind of downtime did you have after each procedure that we did? So we did several different procedures to his knee over a period of time. We did a PRP injection, we did some laser therapies, and we did bone marrow aspirate injection into the knee. These are usually spaced between 6 weeks and 3 months apart. And what was your experience with those? Did you have some downtime afterwards? Have to take it easy for a bit?
Not really.
Okay.
No downtime. I walk out of here and continue as I always have.
And when did you return to work after your procedures?
Well, I've been retired, so
So you're busier than ever.
I do keep busy,
Yeah.
and but I've been able to do just about anything I want, with the exception of extra weight or be sure and careful and where I step and how I step.
Mm-hmm.
But everything right now, I have zero pain.
That's amazing.
Yeah.
So what's life like now? And you said you're able to walk now without pain. What else can you do that you hadn't been able to do in the past?
Well, that was the main thing. just simply going to the grocery store was painful before. Now it's not. The only time maybe even where I have a problem is if I misstep
Mm-hmm.
or add some additional weight. If I grab a couple of bags of groceries and walk to the car, I know it.
Mm-hmm.
I know that I shouldn't be doing that, but just normal walking, I can take the dogs for a walk. There's no problem.
That's amazing. That's amazing. What would you say to somebody who's considering coming to work with us here at Pinnacle Integrative Orthopedics and Sports Medicine with these programs?
Well, I would say if a person has tried what they think is available or is unaware of other things that they can do, that they should explore those options that are available because they have been helpful for me.
Wonderful. Wonderful. Anything else you want to talk about? Anything you're excited about for the program? Anything you want to share?
Well, I'm excited because I'm retired and I'm looking forward to doing things that I've waited so long to do, waiting for retirement. And I was really concerned for a while because you don't want to work all your life just to find out when you retire that now you can't do what you were working for. So,
Exactly. And I think an excellent point. You know, we spend so much time in this country working towards that retirement age so that when we get there, you know, oftentimes we're so sick and injured and we have joint pain and we can't really truly enjoy the things that we've earned. Right. And so that's part of what our goal here at Pinnacle is to give people the ability to do those things into retirement and even beyond. Second careers, third careers, whatever you need to do.
yeah, I was concerned, but the light is a little brighter at the end of the tunnel.
All right, my friend. Thank you so much. Congratulations. You're doing great. And we appreciate you very much.
Thank you.